The second half, a big upset here. First round of the NCAA here. There's the Jaspers coach. Manhattan's up by 6 today. Upset here, first round with a minute left. Manhattan 71, Oklahoma 58. So Nina, what do you think about your Jaspers here?
They are very good. They're winners.
Oh, that's the camera.
It was Jenny's prompting.
We got the doc here.
Oh, you got the game on too.
I think that's her focal point now.
Which team is your team?
Manhattan. What's Manhattan?
Manhattan. Oh, this is NCAA tournament. We in the first brackets. Yeah, Manhattan. Man, there's Oklahoma. You expect them there, but Manhattan is the lower part of the bracket. Yeah.
Dickerson.
What did you?
See it very long. Sometimes medications will do that too, but she hasn't had anything, so I'm assuming that's a sleep cycle. Interesting. Do you notice the baby being more awake during the day or the night, or?
I've been sleeping really well at night. Just towards the end, I felt a lot more fluid, but I tend to sleep well.
Well, that could be good if the baby's awake more during the day. Let's see the underdog win.
There it is, Nina School 1. First round. So they won, Nina. He's got another contraction here. So Dr. Dickerson came in a little while ago, and he said you dilated from 11 o'clock this morning until now from about 1.5 centimeters to 2.8 centimeters. And we're about 50% thinned out about 11 o'clock, and now you're about 80% thinned out. How does that feel, honey?
Good, I hope it continues at this rate.
We're making progress, huh?
Yeah, so far. It continues.
So we had a little good news just a few minutes ago. What was that?
The baby doesn't sleep. Manhattan won. They beat Oklahoma.
Oh, really? Big upset.
Very big.
Put Manhattan on the map, huh?
Hopefully so.
Good luck.
We'll check tomorrow to see how you did.
Bye.
Good evening.
You too.
It's a little after 3 o'clock here, 3:10. The first nurse shift is ending here at 3:15. We'll get a new set of nurses. Dr. Cates just came in a little while ago, and they raised Nina's Pitocin level up. Oops, can't get it focused here. You see her Pitocin now is at 60. Was at 48. So they raised it up a bit. Nina's considering maybe having an epidural here before long. Pain's getting a little more. Contractions should come a little more quickly now that the Pitocin's raised again. So we'll get new nurses here in a few minutes.
Hi, I'm Leanne. I'm your nurse.
Oh,
You might want to turn the video off on this.
yeah.
Anyways, I'm sorry, keep going. What were you saying?
How does it affect the baby?
It does. And the only thing, really, the big side, effective in epidural, the biggest complication, so to speak, is your blood pressure has a tendency to drop somewhat. So what we do to prevent that is I give you a bunch of IV fluids real quick, and that kind of builds up your volume, so to speak, your blood volume, and that helps eliminate the hypotensive effects of the epidural. But you know, if that does happen, even with the epidural bolus or the fluids that we give you real quick, we have medicines right here we give to kind of raise your blood pressure back up. Okay? And it's not a
How
real...
long can you continue to have it?
No.
It doesn't look like any fun to me.
Me neither. Doing great. I'm sorry, what were we saying?
If I get it now, then I don't know how long they're going to continue to give it to me. Is that bad?
No.
Continue to have it?
No. You're, they give you so much medication. Initially, they give you like a big bolus to help get rid of the pain, because you know usually by the time you get an epidural, you're in a lot of pain. So they give you like a big amount, and they give you a little amounts through this pump. Okay, but even sometimes with little amounts, they might have to come in and kind of redose us. Okay, if you have the epidural in for a quote longer time. Okay, it's kind of real individual when the epidural starts to somewhat wear off, and you'll kind of let me know, you know, like, gosh, I'm really feeling a lot more than what I have been, you know, and we'll start assessing you from that point and maybe talk about a little bit more medicine.
So it numbs you from here?
Yeah, basically we like it from, you know, here to here. A lot of times it affects your legs though. Kind of works on gravity, and also it's kind of positional, so if you're tilted one way, it kind of shifts more. So if you're leaning more on this leg might be more numb than this leg. You know, so we'll kind of tilt you back and forth. Or sometimes just the way the catheter is placed in your back might just make you more numb on one side as opposed to another. So it's real sensitive in that area, but basically, you know, it'll be a big relief. Okay. What else?
Is there any side effects later?
No.
No.
You know, like you sign those consent forms, you know, they have to go through all the, you know, just like with any surgery, you know, they always tell you, this could happen, this could happen. But basically, the big thing is mom's blood pressure.
Yeah.
Her blood pressure could drop somewhat. And another thing, sometimes baby's heart rate could drop somewhat. And we expect that just for a few minutes.
And when they actually when you put it in, is she gonna feel much pain at first? Are they kind of dead in the air before they put it in, or how does that work?
He numbs the area before he puts anything in.
Okay. Sounds like a plan.
Sounds like a good plan.
20 till 4. We decided to go with the epidural, right, Nina? Why is that?
Because this is pain.
It's very painful, isn't it? So sometime around 4 o'clock here, we're going to get an epidural and get on with it. As you can see, here comes another contraction. It's very painful.
Clinic, please.
26. Dr. Goldstein just came in and gave Nina an epidural. She's feeling much better now. Miss Leanne signed her up here real quick. Feeling better, Nina? May even take a nap here. 3 o'clock to 4 was pretty tough. Baby's heartbeat still doing good. Kate's here. We'll have another exam here, see how far along we are.
You did on
Get on
that?
my back.
I'll
You
leave.
can stay like you are, that's fine. I just wanted to see if you're dilating anymore.
Nina has an epidural. She's dilated to almost 3 to 4 centimeters now. Feeling much better, out of pain, because she's asking about what she can eat. She wants food. Hello, Nina. What do you want to eat?
Pancakes?
Pancakes. My dad's pancakes?
Yeah. Chicken pot pie? Sounds good too.
My dad's chicken pot pie?
Yeah. Big salad.
Okay. What else? What are you going to feed the baby?
Milk.
Okay. So you glad you got the epidural?
Yes.
Pretty amazing, huh?
It's amazing. What a difference.
So it's about 5 o'clock here, and she's 4 centimeters, got to get to 10. And the doctor said it'd take an hour to hour and a half for each additional centimeter, so we're at least talking, we're pushing midnight before this baby comes. So maybe born on the 16th and maybe born on the 17th. Fun day so far, huh?
Oh, yes. Yeah, a lot of fun. I can think of much better things to do though.
Yeah. All right. You gonna take a nap?
Yeah.
All right. Good night.
Good night. Not much cervix left.
So you think she's how far?
She's like 9 centimeters. I'm gonna give her I'm gonna take care of about
Gee.
30 or 45 minutes worth of stuff, and then I'll come back and hopefully we can get started pushing. I'm gonna have them put your head up a little bit, see if we can get some pressure. Or I won't have them do it, I'll just put your head up. You gonna be okay to do that?
Does she need to change sides?
I think she's okay right now. Right. All right.
Gee whiz, you must have taken off. Here's Tess. Setting up the Tess is setting up the delivery table here. We're getting closer to the big push. It's 7:45. This is the board outside of the nurse's station. We see Nina here, French. She's now fully dilated. This says 9, but she's at 10. She was about 5 minutes ago, and we're going to wait till 8 o'clock to start pushing.
May I help you?
So she's just getting ready mentally and emotionally, and we're going to go to work here about 15 minutes to get this baby out. Here we have Nina asleep. She's getting some rest. You ready? We're at 10 centimeters now, and we're ready to push. the doctor will be in here soon, and we're gonna empty Nina's bladder. It's about 2 to 8, and then we're gonna go for it. Right, honey? And hopefully here in a couple hours, maybe less than a couple hours, maybe 9 or 10 o'clock, we'll have a little one. And we want to know if you little one are a boy or a girl.
That's right.
Nina's done a great job today. She's having contractions even when we got here this morning. And then once they started her on Pitocin, we started having a lot more contractions. And from about 3 o'clock to 4 o'clock, it was pretty bad news in here. She was in a lot of pain, and they gave epidural, and she's done a lot better since, got some rest. And now it's 8 o'clock. So it's almost been 12 hours since we got here. 11 hours and 15 minutes. What do you want to say to the camera, honey? She's ready to go. She doesn't want to say anything. She's ready to go. Yes. 5 after 8 now. God's been good to us today. Got a lot of friends calling, family calling. A lot of people praying for us today. You ready? Nina's ready. The baby's ready. Heartbeat's still good. Nina's gonna do great.
And I want you to pull back on them and curl up around the baby, okay? That's going to be kind of the position we're going to start with the pushing, okay? The movement that you want to have is kind of the down and around. You know that pubic bone right here that's kind of been tender? Well, you got to go down up under that, okay? That's where the baby's got to go, okay? So it's going to be a down and around, just to kind of give you a mental idea of where you're going to be pushing, okay? What I usually have people do is when they start feeling contraction, they'll, tell you one starting or whatever, is to take a deep breath, let it out, take another deep breath and hold it and curl up around the baby and push. It's like a push in your bottom, like having a big ball movement. Some people get, especially with your epidural, you get a little, you push more with your face and all, and I will tell you about that. But what we want to do is put pressure on the baby to push the baby down the vaginal canal. Okay?
Close, Jeannie? Hey, Denise,
Yes, ma'am.
look.
You got it like that.
This isn't, yeah. She's ready to go. You'll hold it, and that's when you'll bear down, okay? And then you're going to count to 10. 1, 2, 3. At a nice pace. Excuse me, this powder makes my nose itch. 4, and you'll get to 10. When he gets to 10, you'll catch another breath and bear down again. And this will happen very quickly, and you'll do 3 pushes with every 1 contraction, okay? And you don't want to really rest between the contraction, between the pushing. You got to just go one after another. With those 3 pushes, you just got to do it to the count of 10. Quick breath and come right back, because that way you're holding the head down to where you pushed it down to. Because initially it'll be a lot of pushing and the head will go back, pushing and the head will go back, okay? Until the head really becomes engaged. And then from that point on, it's a lot easier when I start seeing the head crown up, so to speak. Okay? But in the meantime, it'll just take a little bit of time for the head to kind of work its way through unfamiliar territory, so to speak. You know what I mean? Since you've never pushed out baby and everything. So, Okay. That making okay sense for you? Okay. Sometimes I talk too fast. La, 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 la. You'll get it down. After a few pushes, you'll be like, okay, Leanne. Yeah. Well, I'll tell you what to do and
They're draining a
And you'll
bladder here.
become a real expert
You're in
at
to
it.
push. About to start to try to push here. But try to push, we are going to push.
Huh? You try to position that thing.
Yeah.
Push down, push down, push down, push down.
2, 3,
Keep pushing, keep pushing, keep pushing. You can put your hands back here if you want.
7,
Push down, push down, push down, push down, push down, push down. Take another deep breath and
1,
bear down.
2, 3, 4, 5, 6, 7,
You check
8,
like that look?
9,
No, ma'am.
10.
I just straight capped her. She had about 500 cc's.
Come on, one down. 1,
Into your
2, 3,
kind of told her how to push and
5,
stuff.
6, 7, 8, 9, 10. How many babies you delivered back to back?
Oh, gosh, I don't have any idea. Well, probably.
Lots of experience.
Mhm.
Want to be coming? Ooh, get a little bit of temperature. You felt kind of warm to me.
Alright, then you're up. Now we gotta push.
Yeah?
We gotta push.
Okay.
Come on now, let's go. Come on, big breath. Let's go.
Push out.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Come on, down and around. Let's go. Down and around. 1, 2,
2,
3,
3, 4, 5, 6. Chin to your chest.
8, 9,
Come right back to it, right back to it. Keep pushing, keep pushing, keep pushing, keep pushing, keep pushing.
5, 6, 7, 8, 9, 10. All right. That's good. That's good. All right. All right. You do good. Okay, let's go. Let's go. 1. Come on. Come on. Come on. Let's go. Push. 1. Down and around. Down and around. Let's go. 4, 5, 6, 7, 8, 9, 10. Breathe. Come on. Come on. Come on. Big time. Push. Come on, Nina. Push. 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 3, 4, 5, 6, 7, 8, 9, 10. One more time. Come on, Nina. Come on. 2, 3, 4, 5. Push, Nina. Push. 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 7, 8, 9, 10. Breathe.
This next time, let's
10:15. We've been pushing for about an hour and 45 minutes, and we're still waiting. Nina's doing a good job, but we got a lot more work to do here. Not ready? Come on, push hard now. Let's go. Come on. 1,
Push down, push down, push down, push down, push down, push down. Come on, you can do it, you can do it.
5, 6, down and under. Let's go. 8, 9, 10. Breathe. Let's go. Come on. 1, 2, 3, 4, 5. Push it out. Let's go.
Long and steady,
7,
long and steady,
8,
long and steady, long
9,
and
10.
steady.
Breathe. Come on. One
Right
more
down
time.
here, right down here, right down here.
2, 3. Push it out. Down and under. Let's go. 5, 6, 7, 8, 9, 10. Good. 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 Relax.
Good job.
As you can see, this is not an easy process.
that I gave her.
When?
Nina
Oh,
pushed for
about-
2.5 hours. She did great. The baby didn't come down
Twenty,
at all. We
30.
have a C-section.
21:30.
So we're getting ready here. Probably about 11:30
One
we're
oh
going to
one
start the
what?
C-section. So
At
Nina did
21:45 she
wonderful.
got that. 101.2 is her
we had to
highest
change gears a
temperature.
little bit
Okay.
emotionally to get ready for the C-section.
What else? She ruptured for clear fluid, yeah, Primat.
It's about 11:40 and we're going in to have a C-section. Nina's done great today. It's been a long day and she pushed for about 2.5 hours from about 8:30 to 11 o'clock, and the baby didn't come down at all. It must be a big baby. So I'm waiting to go in for the surgery for her C-section. Dr. Peck and Dr. Shepard will be doing the C-section, and hopefully we'll have a baby here by midnight. And Nina's done great, and the baby, we're looking forward to seeing the baby. See you later. Bye-bye. Dr. Shepard and Peck.
Hello.
So everything went well?
Everything went great.
All right.
Gorgeous baby.
How's Mom?
Mom's great.
All right. Thank y'all.
She's tired.
Bye-bye.
She's tired.
It's the 17th now. I'm not sure if this is our baby over here, but I think it may be. Definitely crying if it is ours. Nina did a great job today. It's a long day. Came in at 8:30, 8:45 this morning, and it's the next day now. Had a C-section. Dr. Shepard and Dr. Peck did the C-section. Baby's got some fluid in its lungs, trying to get it out. So, a big day. Nina's real tired. She's going to have a few days to recover here in the hospital. She did wonderful. See you in a little bit. The baby upstairs. I'm down in the baby intensive care, and the little baby's doing great. He looks wonderful. He's having a little respiratory problem. They're going to give him an IV. In a couple hours he'll be back upstairs in the regular nursery. Going down to see Nina now. Yeah, that might help a little bit. And there we have little baby here. Hey buddy. He weighed 7 pounds, 14.5 ounces, 21.5 inches long. Born at 11:52 p.m. on March 16th. Doing great here. We're in recovery here. Be here another hour or so, and then go up to our room. Nina's recovering from surgery.
It's on this.
Room 21.
Yeah, it's so tight. Yeah, I can see where it's going, but
Almost 2 a.m. now. In the room here, it's almost 2 a.m.
hole there.
Moved her from one bed to another bed.
I want to take this down if I can, because she's not on this pad very well either.
It's a little bit before 7 o'clock here, and Nina's just gotten up and sat on the side of the bed for a second. She did great during the night. We both got a little sleep. If you remember, we were in here about, what, 2:30? So, from about 2:30, you get about 4.5 hours of sleep. Here was my bed. And here's Nina's bed. They just drew some blood from her and they're going to bring the little one in here. And Nina's going to get to see the baby really for the first time.
John. And he's wide awake, too. You see those big eyes through that clip?
Yeah.
Every time that he comes out, somebody should be comparing your wristband with his wrist or footband. He has one on his wrist and one on his foot. Let me show you the number that we're looking for here. See this little blue number right here, B2247. That's the main thing that we're looking at. B2247 is the right guy. Sitting up, but do you feel like you can hold him, or do you want me to prop him with some pillow? Maybe use Dad's pillow and prop him up beside you here. How's that sound? He's got such pretty skin color.
I wonder where he gets that from.
Is that comfortable for him? I gave this to him down in intensive care unit, and we spit up a little bit. He did a little burp rag.
What do you think, Mom?
Okay. Let me tuck this there so he doesn't have spit up next to his face. Did I pick you up too quick, buddy boy? I'm sorry. Whoa, it's okay. Just where'd my donkey go? Isn't he beautiful?
Yeah, have they circumcised him yet?
No.
When will that be?
Probably tomorrow, possibly today, but most of the the obstetricians will put it off a day and do it the next day.
Mm-hmm.
But it's a little bit, it depends on how much time they have when they come and make the rounds. If they have,
So the obstetrician makes...
obstetrician does the circumcision, yes. It's considered a surgical procedure, and the pediatricians are not surgeons, so
Mm.
they do the obstetricians do the... Hey, I know I'm with my mama. Made me happy. This little syringe here is just connected to his IV site. He doesn't have to get fluids like you're getting, but we have to keep a little syringe to flush it with to keep it open.
Mm-hmm.
Have as much hair as I thought he would.
He's got a lot of hair.
You should see his shoulders. He's got hair on his shoulders.
I'm going to step out and get him some fresh blankets and a shirt while y'all tape him and visit with him.
What are you looking at?
What do you think, Mom? You do a good job?
Yeah, you did a great job. What do you think?
Mm-hmm, I think so. So was it worth it?
Yeah. Of course.
He's got your nose. Here you see his vital signs. March 16th, 11:52 p.m. 7 pounds, 14.5 ounces, 21.5 inches long.
looks like they forgot to put his head and chest measurements on there.
His doctor is Bachi, not Benson. Benson and Bachi are in the group together. Dr. Cates, Nina's OBGYN. Dr. Shepard and Dr. Peck delivered the baby. There's a little new experience for Mom and little one. Hey, Mom. Trying to get him to breastfeed. For the first time. They're working?
Doesn't start sucking it, he's just kind of
Checking it out,
nosing
huh?
around.
I couldn't, they wouldn't come out. I don't know. Thank you. Get them out. When did you talk to everybody yesterday? Really?
Yeah.
Did you talk to anybody this morning?
No. عم think اضرب لابوكي مش عارفة. ولا بلاش. هلا اضربوه وخبروه.
Yeah, I guess. When did the torpedo have a quick shot?
طيب ماما بس تطلبي إذا بقدروا يعطوكي شيء تحط فريقك. Like
ice. I have ice
تي بقدروا يعطوكي شوي تي.
and water.
Yeah, تي. No?
I don't know.
قولي لك جيبي لي تي. جيبي لي apple juice.
But I don't know if I can eat anything.
No, بس قولي لها هذا سائل. قولي لها let me have some, you know, iced tea.
So Grandma Rose. Grandma Rose.
Yes, Grandma is right now.
So how does it feel?
Huh?
How does it feel to have another grandbaby?
Oh, great. I can't wait to see him.
Oh,
I can't wait to see that cutie.
he's a pretty.
Thank God Nina's okay and he's alright and everything, you know, when... Oh, boy. Barbara, yesterday. اعتبرتني. Oh, boy.
What did she say?
She was worried. And she came over and made me walk twice and I went and asked her for a candle. حطيتها قدام you know, Virgin Mary of Jesus. You know, but you dilated fast after 4.
Yeah, I did.
Believe me. And I don't know, and I don't أصلي مسطول. But I think that's it. ماما شو الواحد بده يعمل. Thank God.
I'm just really tired.
Middle name Michael? John Michael? That's a good name.
John McCarthy.
John McCarthy. Okay. You got the epidural in. Are you coming? Maybe this evening or tomorrow. Are you drinking plenty of fluid?
No, should I be?
If you don't want to, you're getting plenty of fluid in your IV, but
I am thirsty, I just wasn't sure.
the more you drink and, you know, caffeine, you should be around a little bit.
So I can drink any liquid?
Lipids are, like pure lipids, but again, you don't need so much nourishment because you're getting the IV.
But I can go ahead and drink it. What about food?
That's a night problem. When you've had surgery, your intestines are a little bit slow to function. So you may have gas buildup. But, see, Shepard, Beck and I are going to be in going down for the papers not going this weekend. So you can't all the time take pictures.
How long will you be in the hospital?
You may go home. See you delivered after midnight, didn't you? Go until Sunday.
Good.
Today's your first day, then tomorrow's your second day. Fifth day, and then you go
I
Sunday.
think so. The baby was delivered about right before midnight, but she didn't get out till.
Well, it's still, most insurance companies allow you to stay an extra day if you deliver after 11 o'clock. So to call it and check on that, okay? But generally speaking, today will be your first day, and then tomorrow will be your second day. All right?
Good.
Okay. And if there's some hang up, your insurance company does not allow you to stay, if they count yesterday as your first day, and if you did have to leave tomorrow, it would be, unless there was a medical reason to keep you, we would keep you until late in the evening. But I don't think it's going to be a problem. It's most of them are 11 o'clock.
What is Syria? I don't know if they
It's been for a while. The epidural, though, is pretty nice. The new epidural morphine, and literally, the moms having sections today acting like moms who had sections, by the third or fourth postnatal day 10 years ago. So you have less discomfort, you get up and around a little bit better.
So the epidural set pretty low though?
Yes, it's very low. It's just a very little bit of medication that just goes in, and it's Demerol. It's not anything that really prevents you from moving it or make you numb, but it takes away a lot of pain.
And then these tablets today sometime?
I'm not sure. I think it depends on how you're doing today or tonight. Okay.
Well, she did good. The baby didn't want to come out.
You grew too big. But you
That-
dilated up pretty quickly. You see,
Yeah.
you were 3 to 4.
When you checked,
When I checked you at 5,
Four-
right?
4:20.
4:20, and then you were complete by
2.5
4:85.
hours. Yeah, 3
Yeah.
more hours. She flew. Because when Beck checked, you were like, she said 9, 8 or 9, and then she checked again in an hour, and she was all the way. And then it was 2.5 hours of pushing and nothing.
Did well.
Yeah,
I
she
guess
did
this
good.
means we won't see you weekly anymore for a while, huh? No more collecting urine on the little cup.
No, that's good. Do I still come in for?
You'll come in in about 2 weeks for a post-op check, and then about 6 weeks for a postpartum check with your pap smear. They check it.
They use staples?
I'm not sure what they. I usually use a suture, unless somebody said a refit. I think most of the doctors use staples.
How does that work?
Yeah, they use staples. It just kind of holds the skin together, and then when you come back in the office, unless they take them out Sunday, they just do a little quick remover and pull them out with a strip of tape on it.
So they put the staples out after how long?
3 days or more. Okay. Very good. Well, what's it like holding them this way now?
I'm still, I can't really hold anything. That's nice.
It's neat, isn't it? They make all those little noises and they.
Thanks a lot.
You're very welcome. Y'all did really well yesterday. It worked out great. You actually got dilated up all the way like the I thought you would. I expect you to dilate up not that fast.
Well, I have to videotape you on camera. Let's hit the lights. Grandma?
Yeah?
Hey, is my mom or dad there?
Yeah. Let me get them. Hello?
Hey,
Hey,
how you doing?
you're doing fine. Let me holler at Dad. Boss, come on. Tell me what's out.
Well, we had a baby.
Okay.
have a little baby boy,
Right.
and
How much? How much you weigh?
7 pounds and 14 and a half ounces and 21 and a half inches long.
What, how long?
21 and a half.
21.5 inches long.
He was born at 11:52. Yeah,
Right, so let's see, that's 16.
yeah.
Okay. Wonderful. How's he?
She's here. She's doing fine. She's
Tired.
yeah. We had a long day. We went 11:52 last night. She I guess from about 8:30 to 11. I mean, we pushed for 2.5 hours and the baby didn't move. I mean, didn't move an ounce.
That's the right position.
Yeah, but it didn't want to come out. So she had a C-section last night. So she's doing good, but long day.
How long does she go to the hospital?
Probably till Sunday. So she's here.
Gina,
Yeah. Good morning.
congratulations.
Thank
I
you.
know it was tough, but we're happy. We're real happy for all of you.
It was worth it.
Huh?
It was worth it.
Oh, I know it's worth it. Well, we'll see you tomorrow.
Okay.
We named him after you, Dad. John Carlton Prince III.
Well, I wondered what y'all was gonna name it, but I'm proud of that.
So
After you too.
yeah, I guess after me too.
Have you decided what you're gonna call it?
No, I don't know.
Well, you'll have a while to do that. Well, I won't be around long. You can call him John if you want to. You can call him anything.
Yeah.
That's what we've been calling him now.
We're thrilled to death, and we want to have his mom. I have
7, 14 and a half.
wasn't that big, you know. I mean, what's the effect? What, 6121?
Yeah.
Okay. Now, do you want to call the girls, or do you want us to call them, or what?
I don't care. I mean. Hello.
Hello?
Hello?
Yaba?
Yeah.
Good morning.
Oh, good morning, مبروك.
Suez?
Yeah, الحمد لله على سلامتك.
Thank you.
كيف انت يابا؟
I'm fine.
الماما just يعني حكت معي هلا فيش 5 minutes.
Okay.
Yeah, so you are all right?
Yeah, I'm fine.
Good, and the baby?
Baby's good.
Good. I'm very glad for you, Nina.
Thanks.
هلا الحمد لله على السلامة. Okay يابا؟
Yeah,
ديري بالك على حالك وعلى البيبي.
I will.
Okay?
Okay.
Don't worry about nothing. Just take care of yourself now.
I will.
Okay, Eva?
Okay.
Okay. Thank you for calling.
Okay.
All right,
Talk to
bye-bye.
you later.
I'll be calling you.
Okay.
You need the number?
Goodbye.
Isa? Oh,
I
yeah.
think he's gonna call it home.
No.
Where was he calling from? New York. What language? Sounds like he was excited to see Grandpa.
And there's other tests we have to do. And all that. But hopefully it'll be fine. I mean, he looks fine. Hopefully that test is going to be normal. But that's just a possibility, so we want to let you know that.
So it's from the fever?
Because you had a fever and you were treating antibiotics, he's at risk for infection too. So, and newborns can get sick really quickly. So if the first sign of anything or any possibility, we put him on antibiotics. Because, they go downhill so quickly. But he looks great. I don't think he's going to have any problems. So hopefully all that will be normal. He'll go home when you go home in 2 days.
How did he check out?
He checked out perfect.
Yeah.
Yeah. His blood count looked fine. But like I said, we have to wait on that blood culture and that other test. That'll be drawn tonight. It'll be done tomorrow. Yeah. Blood culture is just a sampling of the blood to see if there's any germs that will grow in the blood. That's what we worry about, infection of the bloodstream in the baby. So, and I'm sure they printed that on YouTube. But he looks great. I really don't think it's going to be a problem, but I just want to let you know that in case that one test is elevated, that he would have to stay for a week. But it's called a C-reactive protein. It's kind of a measure of infection, inflammation, to see if there could also be an infection in his
Just got
bloodstream.
rolled in.
But, I doubt it's the way he looks, but I don't want to tell you that, and then tomorrow I come back elevated, and you have to stay here. So, probably midday tomorrow. They'll draw it like late tonight when he's 24 hours old, and then he'll be back sometime tomorrow.
Are you taping everything down?
And who are you?
Cindy, the lactation consultant.
Oh, boy.
So this is a good thing to tape. Makes for easy breastfeeding. You can put your legs down if you want to.
You want to put this pill behind the back?
Really sitting straight up and down. Lean forward here. Just lean forward. Stay straight up like that. There you go. Give it a second, it'll kind of ease up. Now, isn't that better?
Yeah.
He's ready to go.
He's too.
That's right. Dad gets you checked in.
Let's see, do we have a,
And we got your nose.
can we use this pill, or are you gonna lay back down anytime soon? This would be good for the,
I'm just going to bring it around like this.
you just use one of these pills then?
Got your chin, too. Your mama's boy.
Of course, she's leaving, and you want to come out and get the mama's boy.
Okay, now we can put him in a position where he doesn't have to lay on your stomach, okay? Your stomach's real sore.
You want me to get one of those too?
Yeah.
I usually use one of those.
Remember all this now, Sharice, we can check off your checklist.
Yeah, I know, I was thinking
Here
about
you
that.
go. Got plenty of hair. Hey there, you see the camera?
Okay,
You ready?
we're ready.
All right. Go to work, buddy.
We're going to put him in a football. Made all this stuff.
Starting
He
a
has
little feeding
reflexes
here.
and he has responsive, but he has to coordinate it all together.
You're really beautiful. You ready for your mom?
Hi,
Don't get too close.
Mr. Woney. Mr. Corton.
Hi, Mom. You're Patty.
So what do you think there, Miss Rose?
He's cutie. He got Nina's face like when she born,
Yeah?
but he got you too. Both. You could see both in there. Oh, his hair is pretty. It's gonna be more lighter, like you. إيه، هذا اللي كان يخابط كل هالوقت ومش قابل ينزل امبارح يساعد.
Oh, that's Diamond now.
He didn't want to come out. They wrap him so.
Yeah, I told the nurse to wrap him.
Boy, he's a man. He's the real French wire. Work hard. Mr. Corton. John Corton III. The real French هذا. Hallelujah. So you okay?
Yeah.
All right.
You got something. You a mommy.
Yep.
And there is Big Daddy. Hey, mister.
So what did the nurse say about feeding you?
She said every 3 hours.
So it's about time.
Well, she thinks it was 8:45, and then 3 hours after that.
Okay, so pretty soon you can try.
بفتح عينيه. He opens his eyes.
Yeah.
شو لونه؟
It's dark.
مبين شلة.
They almost look kind of blue, but
He didn't wake up. He cried.
yeah.
He
not
ate
before.
anything.
Not too much.
Some, yeah. A little.
What did they give him?
They fed him, but I've tried to breastfeed him.
Oh,
Ate a little
but
bit.
you didn't have milk in your hand.
I think I do. They said so. But
Trying to get him to eat a little bit, and he doesn't want to eat.
Want to eat num num? Num 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 num.
You want grandma to feed you?
Num num num.
Cutie.
Say in another country, that's what would happen. Say if mommy didn't do it, then grandma would. Huh? Yeah. Or some,
Yeah,
I heard that.
Why?
Want to try to eat?
You hungry? No 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 no.
Yeah, you could suck his hand. Yeah. Take your finger.
You want to try? Want to try on this side?
Since it came out this evening, we can try taking that out. I think we could let you probably have some pain medicine in the mouth and get some of these tubes out of your arm so you can get up and get around to the bathroom a little bit easier. Get you feeling like you're a little more normal than being bound all down in the bed like this. And tonight or later on this evening or sometime tomorrow, if you don't want to get them circumcised, I can do it for you.
yeah,
Do you need anything to pick up right now?
no, but the pain and the incision, the real initial pain, does it take a week or more to cool?
After the first 3 or 4 days usually is the worst of any of it, and then after that it gradually gets better. And we do give you the pain medicine to take up to every 3 to 4 hours if you need it. You'd be abnormal if you didn't hurt some from having an incision. And so we expect you to do some, and we want you to take the pain medicine so you can get up and move around, and not just lay around and get nothing to move with. So it's normal to hurt at first, but that does get better. So it's not going to be all like it is right first time. You will be okay. All right. What I'm going to do is later on this evening, we'll get him to take some of these things out. And, if you want to try the food tonight, that's okay. If you just want to just drink and the fluids and the liquids and some of the juice, that's okay too. Sometimes some of the things that are not sweet taste better for you, rather than just juice and jello and all this sweet type stuff. Sometimes that kind of makes you kind of pleased. So try something that's a little not sweet. If you want some coffee or tea, anything like that is
What
fine.
about on milkshakes or milk?
If you want to try it, it's fine. It's whatever you're looking for. Okay? Good. So let us know if y'all need anything.
Thank you.
Well, you got your hands full with all
That's
that.
right. Thanks,
We got a
Doc.
nasty looking day out there anyway, so I tell you, it's just.
There's Jay and Carlton, Daddy and little Carlton.
He's backward.
Is he sleeping, Jay?
He's trying.
He's not sleepy. He's soaking.
Let's get Carlton on video.
Here we go.
There he is. What a beautiful baby.
He's a beautiful baby.
Cute little guy.
He'd rather be inside Mama than outside right now.
Oh, yeah.
Hello, mister.
He's doing good. He just spit up a little bit. That's a good sign.
That is good. You've been trying to feed him.
He's trying to sleep now.
Hi, His cheek.
There you go.
There he is, opening his eyes.
Hello.
Hey, Carlton, open those eyes.
Right cheek.
Open the eyes for the camera.
Turn him like this, so he will be in the light.
There he goes.
Ay, ay, ay.
See, he has a little IV in his hand here.
Yeah.
He had a little temperature when he came out because Mom had one.
Well,
Yes.
you were walking in.
But he's doing good now. 7 pounds, 14.5 ounces. He's a big one.
And what's his name, his full name?
He's John Carlton Prince III.
What are we going to call him?
Call him Carlton,
Okay.
named after his grandfather,
Uh-huh.
Mr.
Oh, you
John
do
Carlton
have-
Prince
Oh,
Sr.
it's in the family.
And also his Uncle Carlton, who would be a great uncle.
Hey,
Ah,
Carlton.
he's looking at the camera. He knows mom is sure that.
Smart little guy.
Little munchkin. You smart? Smart, isn't it?
Has he been sleeping a lot?
He is so pretty
Today?
face.
He
Like
has
the
been sleeping.
moon.
He didn't even when he wake up to eat.
His face is round, so pretty. And his eyes wide open. Oh, he's looking at
He's looking around.
Oh boy.
Hey, buddy.
Who's there?
Look at all these new surroundings here,
Oh
huh?
my gosh. Who is there?
I have a feeling he's going to be awake tonight.
He's a lot of everything, Lena.
Oh, yeah.
But he's like Lena. Very smart.
Okay, honey, you can
Right.
cut it now.
He's like his daddy.
Very smart.
Lock here, and Nina has her catheter out now. So next time she has to go to the bathroom, she's gonna have to do it on her own. See little Carlton here with Mom. He's snoozing away. He's enjoying the sleep. Nina's been in and out sleeping herself. It's been a good day. He's not even a day old yet. Number 21. As you can see, there is a blue ribbon on the door. Blue ribbon for Mr. Baby Boy Carlton. It's about 4:40 in the morning on the 18th. Mom and Carlton are a little over a little after a day after their delivery, and had some trouble feeding Carlton. And now we have Nina's feeding him now, and he's doing much better. He's having a good session right now. So let's take a look. Nina's making a lot of progress. Hey hon, how you feeling?
Fine. One more piece.
You got the IV out, the epidural out, catheter out. You're not hooked up anymore, huh? The doctor said you're progressing well. She's gonna be up and about today, walking around a little bit.
It's all out.
Some rest last night. Good rest. Maybe even take a shower today, huh? Your first shower in a little while. Obviously, you're probably pretty stinky, huh?
No.
No, you're not stinky. Hopefully they'll be giving you breakfast soon, and Mr. Carlton should be coming back to get him some food pretty soon.
Yeah, not now, probably.
Here you go.
Thank you.
Should have some visitors today. We're going to probably limit the length of these little visits, so we don't wear Mom out. And probably go home tomorrow, sometime later on tomorrow. Okay, honey?
Sounds good.
anything you like to say?
Until tomorrow.
Till tomorrow. Alright.
I'm Dr. Vincent's partner.
Yeah.
I just wanted to let you know the baby looks good this morning, okay? The blood culture has not grown anything at 24 hours, but it's not going to be 48 hours until 1 o'clock, actually tomorrow morning.
Mm-hmm.
We're waiting for the CRP, that's the other marker for infection Dr. Vincent talked to you about yesterday, and that should be back sometime today. So if things work out, and tomorrow the baby hasn't had any problems, and the CRP is normal, and the blood culture did not grow anything at 48 hours, we'll stop the antibiotics and let the baby go home. Okay? So far, like I told you, the blood culture hasn't grown anything. If there's any problems, any of those is elevated, then the baby will need to stay for about a week of antibiotics. It's called C-reactive protein, and it's a marker for infection, and it does become elevated when somebody has some type of infection. Wherever, you can have an ear infection or a throat infection, it'll go up. Okay? So we have our fingers crossed. But the baby's doing fine. Looks good.
Now, the Apgar test, how did that do?
What was that?
The Apgar test, how was that?
The Apgar, the baby had, I think, an 8 and 9. Let's see. But she didn't write it down.
Yeah, that's what they told us, so that's good.
Those are good. Anything above 7 is good. 10 is perfect.
No, we don't want a 10.
And I've seen very few babies with 10s.
Really?
Yeah, because they always look blue in the hands or feet.
Yeah.
So you have to take 1 point for that.
Oh, okay.
So only the pink ones are the ones that get 10.
Yeah.
So 8 and 9 is very good. Okay?
That's good.
So you're going to stay till tomorrow morning? Is that right? Tomorrow evening. Very good. Well, I'll be rounding tomorrow morning, so I'll come back. Kind of give you an update, okay? All right.
Thank you. Bye-bye. You.
My name is Diane Frederick, and I'm a lactation consultant.
Oh, thanks, Diane. How we doing over here?
Oh, got everybody on tape. Doing great. Doing real good.
Okay.
He's a champion nurser. He sure is.
Mom's doing good?
She's doing great, too. How's that feel, what he's doing right there? He's not doing that. Yeah, you see, he's pulled off there. When you see his chin is just kind of going like this, just real fast, he's not on as good. You have the perfect nipples for breastfeeding.
Hold on. Ian, what are you doing?
Eating my first meal in 2 days.
It feel good to eat again, huh?
Yeah.
This is a late breakfast, huh?
Eggs and grits. Biscuits.
Okay. Did Mr. Carlton eat anything today?
Just finished eating a little while ago.
Yeah.
He did good.
It's best eating yet, huh?
I think so.
He's a cute kid.
I was really hungry. He's a very cute kid.
So you looking forward to taking the first shower here today?
Yes, I'm looking forward to freshening up. Fixing my hair. Walking a little bit today. That would be good.
So how's Dad doing?
Well, he's been doing real good. Big help. Especially with Carlton. It's been good having him here. Helping me out. Spending the night in that little couch over here. Opens up into a little bed.
Mm-hmm.
I think he's gonna go take a shower now and go get some breakfast.
Oh, okay. So he hadn't eaten breakfast either, huh?
No.
So the baby came first, huh? And Mom second.
Baby first.
And Dad last.
Mm-hmm.
Oh boy. I see how priorities are already changing.
That's right.
Oh, honey. Nina's getting to brush her teeth for the first time. She's having a good time here. She's going to take a shower in just a few minutes. Here's Nina. Blow drying her hair after her shower here. Very refreshing, huh? And in the background we have Miss Rose and Pastor Stone out on the patio. Pastor Stone stopped by to see how Nina's doing.
Every day.
He's a cute one.
When is it? Not going to go home.
Tomorrow. It's only late afternoon,
Yeah, with a C-section, they want to give her a little more
Right.
time.
Right. Enjoy being waited on.
right? Not nice, yeah.
So you've been out playing tennis?
Yeah, tennis match this morning.
That's good. Are you in Alton?
Yeah. You play tennis?
I used to before I retired.
We retired.
No, I'd like to get started. That's a good sport.
We pray that he will grow and mature as he comes to understanding of spiritual things. Nina and Jay will just build into him all the truths about you. May he grow up to be a young man who loves you with all his heart, soul, mind, and strength. What I pray for the next few weeks is they go through the adjustment of a brand new little baby in the house, maybe some late nights and understanding schedules and all that kind of thing. And she'd really give them a special measure of grace and extra peace and discernment through this time. And may it just be a rich, growing time for all three. I pray this in Jesus' name.
Amen. Hey,
How you doing?
I'm fine. Hi.
come in. Come in. Come in.
Thank you.
How are you?
Good.
Doing good.
Good.
Tracy and Sandy are here. Jennifer
I
Beaver.
came by earlier, but it's dark and I could probably sleep, so we turned around and walked out. Hi, it's nice to see you again.
Me too.
This is Jennifer.
Yeah.
This is Tracy and Sandy. This is Jennifer.
I'm Tracy, this is my wife
And I'm
Sandy.
Sandy. Hi, Tracy. Hi, Sandy. Hi. Nice to see you.
Till 5, see how they go. Well, I guess it's around like 3:30. So give me that up.
Forget this. Mom will be here. I might as well do it in comfort.
I'm gonna have it later. If it's gonna get worse than this, I better get it now. No sense.
That's right. Why put yourself through that?
You're here to
Relax and enjoy yourself.
Getting an IV here.
There you go.
Some antibiotics.
And we'll let you come in and see Mom. Is there a drink machine close by? Do you know? Is it round?
Downstairs where you were, if you go from your room, that room you get on the left, you go around that. No, I'm sorry.
He's getting his IV here. They're running some tests on him because he's got, he had a fever when he came out.
He's a nice looking one.
Yeah.
Grandpa, you say hello?
Yeah, you got a smile, boy.
You look like a French.
Yes, you do. You sure do. You look a lot like your daddy.
You sure do. Look, yeah. Look at that hair. John said if it didn't have the dark hair, then something's wrong.
That's what we say. Good boy. Have a lot of hair all over.
He didn't want to come here, though, I'm telling you.
He was baby. Big eyes, huh?
I'm telling you,
Oh yeah.
you had a tough time.
He was a week late and he still didn't want to get here.
We worried about y'all, but that wasn't much help on here.
You finally made it, huh?
Now tell me what this is.
Oh, I had a fever towards the end, and because I had a slight fever, he got it too. What they're giving him now is IV to fight infection. Doing some blood tests. It's okay. Yeah, Mom.
Except she's giving you the wrong way. No wonder. Yeah. Hey, look at here. Hey, look at Grandma.
She doesn't know how to hold things.
Yes, I do know how to hold it, but I'm holding it with the wrong arm, that's for sure. Yay! Don't see what Grandma can do. Grandma can make this boy. Look at you. You look so much like your daddy. Yeah, except Daddy was thinner.
You got this Jerry's chin, all right? You got her nose and
His nose is a little wider than Dave's.
eyes. Her eyes. You know how she ends up with somebody like that.
They should be. He's a rounded face, like a moon. He's so cute.
Well.
Look, he's alert too. Aren't you?
Looking at this, wondering if I want to stay in this world.
He's looking at you, Mom.
He's very alert. He's around.
Yeah, who's this?
Now, I don't
You don't know
remember Jay's
anything
face
yet.
being this pudgy.
Chubby.
He was so thin, he wasn't
What
pudgy.
color was his eyes?
Well, they're gonna be dark, you know that.
They almost look blue now, but
They would
might turn
Dark.
dark.
Oh, he'll have your pretty eyes. Yours and Nina's pretty eyes.
I thought you might have your blue eyes.
You're a smart baby.
Yeah, see, I am gonna be the smartest one. Yeah. See, I love the
He's nice and quiet.
I like it. Johnson.
Only thing we gotta decide now where you gonna use your left hand or right hand.
That's a lot to put on the
Your daddy
baby.
uses his right, your granddad uses his left, so let's see which one you click.
Right, your name is John Carter? Right?
That's right.
I've been telling him. And then when he saw I thought that's a boy, then no, it's a girl. No. No way it's a boy.
Jay, what did you think? What did you really think it was?
See, because
I said it was a boy all along.
boy is strongly.
Listen,
Well, as hard as I looked at that sonogram, I thought it was a girl.
he was
I
such
couldn't
a
see
fool
it.
for long, baby.
Did you think it was a girl?
I thought it was gonna be a girl, cause the nurse told y'all, if you don't wanna know what it is, don't look right now. And I was looking at everything, I couldn't see it.
The nurses at the doctor's office said they thought it was a girl
Oh, is that right?
because of the heartbeat was fast.
Oh. She's a good boy. Well, all right, Jay, you'll have.
Oh my goodness, there's a little tiger.
She has an Auburn Tiger.
And there we go.
There's
So,
another Auburn Tiger. Manhattan's the one that's playing good ball.
Yeah, we watched that game.
in fact, it's going to be on in 20 minutes.
Part of labor. This is cute.
What I had for the little girl was cuter, but, cause little girls' cute things are cuter, but,
Oh, you know about fuss.
oh, and you probably have several of it, but if you don't, I mean, I can take it home
I
and
like
take
this
the
rock.
price off.
This one of
Do
those
you-
gliding rocks.
But, do you have,
Spontaneous. Figure you want to be sick.
Jeff Edwards here. Hey, Jeff.
Hey, guys. Put that thing down.
Everybody's the patient consultants, all the doctors, the pediatricians, everybody that came to visit is on video.
Lady at work.
Anything happened, Jen? He said, new arrival, new arrival. And I said, has Nina had the baby, Jen? He said, new arrival, new arrival. I said, quit acting silly and tell me if Nina's had the baby. He said, I got a baby.
He was going to do that again to you.
He was.
I said, you better not.
oh, I agree with that.
I worry when I look for something to worry about.
Right? Great cry.
Yeah.
Really is.
Yeah.
يعني بيقول لك شيء سخن القلب.
No, بكرة جيبوا لي ينسون.
No, I mean like الشوربة باي شيء.
Oh yeah, بيجيبوا لي هنا.
شو الشوربة بيجيبوها؟ أعمل لك شيء يجي معه جاي.
ينسون.
There go 3 of the grandparents there. Mom and Dad French and Miss Rose. Gonna take some flowers back to the house for us. Down the hall with the nurse. Here's Nina out in the hall for the first time. It's almost 5 o'clock. Saturday afternoon. Less than 2 days after she had the baby in the C-section. What's that?
I'm doing good.
You're doing very good. How you feeling? Yella, Nina.
I'm going as fast as I can. This is good.
The nursery. Hey there, Miss Laura.
Hi there,
It's
little
Miss
John.
Laura Adams.
You're gonna call him Carlton? Hi, Carlton.
How
We're
are-
so glad you're here.
Yes, we are.
We're excited. That's wonderful.
Hey, Mom.
Hi.
Now, 9:20, and Nina and baby Carlton are feeding over here, side by side. And he just had his circumcision done probably about 30 minutes ago, so he's a little upset this morning. Everything looks okay. Nina's doing better and the baby's doing better. He weighed 7 pounds, 14 and a half ounces when he was born. He's lost about 7.5 ounces so far since he's been in here.
Unless Dr. Vincent comes in today. Cover up. Dad's taking pictures again. Try to get some exposure going on. Okay. I know. Got you all calm and comfortable, and now I'm bugging you again. And it looks like it's oozing just a little bit underneath here on the bottom. Okay, so we'll just keep an eye on it and we'll look at it again in a little while.
And the blood culture hasn't drawn anything so far. We're contacting the lab to confirm it because they should have read it again this morning. But so far it's negative. So. Baby had a slight elevation in temperature last night. They told me about it. Right. At least until you can get your milk coming in real well. And what I'm going to do is, if the culture is negative, I'm going to stop the antibiotics. And I'm going to probably just watch the baby through the afternoon, and then later this afternoon, we'll probably send the baby go home. When are they going to let you home? Do you know what time?
I said whenever we wanted to go. I mean, it could be late. We could go late if we wanted to.
Okay. Well, I'm gonna let the nurses know just to watch the baby off of antibiotics until about 5 or 6 o'clock. Okay? And then at that time, if the baby has oh. The lactation consultant talked to you, didn't she? Yes. She met with you? Yes. Oh, Daddy.
How much weight do they normally lose?
Have you had any more fevers, Mom, or anything like that?
My temperature has been going between 99.
So you've been having kind of a...
Well, anytime somebody makes a sudden noise, he jumps.
Oh, I'm sure she will. Hi. It looks a little bit yellow.
Yeah, they said you had a little joint.
A little jaundice. You can see it in the white of the eye. It looks a little bit yellow. It's
Yes, I noticed.
Yeah, it's easier to see with the sunlight. But babies will. Yeah, and then it just starts slowly getting better. It tends to peak at the 5 or 6.
Why is that?
It's because their liver cannot metabolize that pigment, and it just accumulates in the skin. Their liver is not mature enough to do it. Most of the time.
He's about to get his heel stuck here. You're drawing blood, right?
Uh-huh.
Blood for some lab work. Ooh, he didn't like that. Hey, buddy, it's okay. It's okay. It's okay. It's okay. I'm going to take the IV out of his arm here.
Oh, and we're gonna cry like the Dickens, Dad. We're just gonna not like this.
Well, he's having plenty of crying today from all this
From
sticking him and cutting him and taking the IV out of his hand. Walk. She's walking much better. It's Sunday afternoon, about 3:19. We'll be going home today. See how much better she's doing today. Hello, Mom. You doing better today?
Yeah. Much better. How's little Court?
He's doing good. There's Mom. Pretty soon you're going to be running,
Walking real fast.
trying to chase down this little guy.
That's right. Let's go. Here's Daddy and Carlton.
Hey there.
How's little Carlton doing?
He's doing great.
Where's he going?
We've been going on a little walk. See?
Hey, Carlton. Look at the camera.
He's looking at Daddy.
You're too busy looking at Daddy, huh?
Yeah. Yeah.
He's a good boy, isn't he?
He's a real good boy. He's been eating better.
Good.
Mama's feeding him better.
That's good.
We're going home today.
Yay.
Yeah. Come on, let's go for a walk.
I guess he's excited about going home, isn't he?
He's excited about going to his own room. His own room.
And all his toys.
See? There he is.
He's a cutie.
Yeah, he even has little hairs on the back of his ears here, see?
He's a hairy little Carlton.
He's good.
Let's get a good look at him.
Who you got there? Oh, really? You looking forward to going home?
Of course, yes, I am. I'm looking forward to getting much better.
So has this 3-day experience been worth it? Got a cute kid, huh? He's sleeping. You gonna take a nap now? Okay. Good night. Time to go home here.
Good view from up here. Yeah.
And I just not going to do that now. So make it home.
Mr. Carlton's crying on the way out of here.
You can even sit out there in the car and nurse him a little while before you go if you want to. Thank you. Let it John. Yeah, he's up and hungry now.
Here comes Mom and Carlton. He's even crying a little bit here. Mom getting in. Mr. Carlton in the car. He's loving it.
The camera.
He'll get good
Look at
at it.
Daddy.
Hey, buddy. He's fine. Hey, Mom.
Hi.
Huh?
We're finally home.
Oh, there's Grandma Rose. Hey, Grandma Rose.
Hi.
So who came home? Who came home, Grandma?
The king.
King Carlton, huh?
Yes, King Carlton. Oh, what have you?
Night, March 19th. Almost 11 p.m. Nina just finished feeding him and he's asleep. Mr. Carlton's asleep his first night at home. You see he's sleeping away. Hey, Mom. How's Mr. Carlton doing tonight? How's Mom doing? Okay, good. It's Monday morning. Mr. Carlton's got the hiccups. His first hiccups. Hey, buddy. He's got his little long shirt on here. He's observant, looking around. Rose out walking. He's in his room playing.
This thing I have to wash. Put him back so he can see himself in the mirror.
Yeah. Yeah. Maybe your Sesame Street? Yeah.
Is he having a fun time?
Yes, he is. He's playing in his room for the first time.
Oh boy. What's he playing with?
He's playing with his Sesame Street friends.
He looks like he's having fun.
Yes, he is. He's getting a suntan.
Good. He needs some sun.
Yeah.
Sun is good.
How's Mom doing?
I'm doing good.
Yeah?
Getting better every day.
Okay.
How's Dad doing?
Dad's doing great.
He's been a big help, Dad.
Yeah. Mr. Carlton's eating better, and Mom's doing good feeding. So we're taking one day at a time. Actually, 1 minute at a time.
Yes, alright. He's being a good boy, huh?
Yes, he's always good. Okay, Mom, go take your shower.
Okay.
Bye. He's playing with Big Bird.
Baby. Back in my country, it was a German lady that she needs, and I got it from her.
Oh, yeah.
And it's now like a 30 something years ago. Yeah.
You need to pass that on.
No, Karen. I don't know nothing.
Nothing. You just come up
Nothing.
with this yourself.
Yeah. You look inside, outside. No,
That's a true talent.
Beautiful. Okay, Nina.
Take a look at him.
Here's Mr. J with that camera.
That's right.
And brighter.
Amaze me. And opened. Babies stays till sometimes 40 days that they really, start looking and by hand.
He's very observant.
Look at him.
Tuesday afternoon, I'm at Dr. Lachi's office. I'm already understanding what it's like to be a stay-at-home mom. The doctor's office is a disaster zone. Kids running everywhere, throwing things. I'm sitting over in the corner with Mr. Carlton, trying to keep him away from all these kids.
You need to help me? You need me to help you? Okay, 3.6. He is 7 pounds, 15 ounces.
With everything on.
Yeah, with his little outfit on. That shouldn't weigh too much, though, I don't think. Is 21.25 inches. Is that what they got at birth?
21 and a half.
Oh, well,
He shrunk.
yeah, maybe I could get him to stretch out quite as well. Come on. Hey there, baby.
Mr. Carlton, he's doing good. He's 36.5 centimeters. That's the diameter of his head. His temperature was 98.4 today, so he's doing great. And he hadn't eaten here since about 10 o'clock, except for a little bit of milk I gave him. So he's being really patient, waiting on the doctor. So here, as we wait on the doctor, whoops, there he goes again. Got another kid crying in the other room. Here's his big hiccups. Oops.
Look who's there.
Hey, buddy. Hey.
No, this doesn't taste very good. This doesn't taste like milk, huh? Tastes like wood. I'm so sorry. See you in a minute here. The circumcision looks good
Yeah, we've been putting that Vaseline on it. How long do we do that?
for about a week.
Okay.
It's drying up pretty nicely. So in 2 or 3 more days you can stop doing it.
Oh, stop?
Yeah, just for 1 week after it was done.
Now, my mother-in-law's there at our house, and she thinks something like called fennel seed, water and fennel seed will get the baby to go. We don't need to do that, do we? Or have you ever heard of something like that?
I think the main thing you need to do at this point is get those feedings going.
Okay.
I don't think he's constipated. I think he's just not passing stool because he's not
Eating enough.
He's not quite getting enough yet.
Okay.
Which is not unusual. Some babies, especially breastfed babies, until mom can get those feedings going well, the babies may take a little while. Hi, what am I doing to you?
He's got some reflexes.
What am I doing to you? He looks pretty alert.
Yeah, that's what I was saying.
Hi, Munchkin. Okay, cutie. It's all right, Munchkin.
So what's the verdict?
Well, he looks good. He looks well hydrated to me. The inside of his mouth is wet. He's got plenty of saliva, and he's alert. He's awake. He's got good turgor and everything. So I think it's just a matter of waiting 2 or 3 more days and really get going with those breastfeedings, and that he'll pick up. Okay. The jaundice again. Have the mom breastfeed the baby near a window where the baby can get some sun on this directly on the skin. Okay? Early morning, late afternoon, not the middle of the day. And
Now, when she's breastfeeding, he doesn't need all these clothes and stuff on, right?
no, because
He was burning up.
yes, exactly. Because mom is warm, and babies can get really overheated if you have them so wrapped up. And,
Yeah.
you know, the days are warmer now. I would even tell the mom if she's gonna breastfeed.
Hi, Dad.
Hey,
What are you doing?
well, we're watching Mom on TV have her baby, watching the video, and
And who's that little guy?
we let Mr. Carlton sleep right here.
Is he sleeping?
Yeah, he's sleeping. He just fell asleep. He was a little fussy because he wanted me to hold him.
Oh, really?
Yeah, he's a very good baby.
He didn't want anybody else to hold him, huh?
No, I don't know. He probably would have let Mom hold him, but he likes Dad to hold him too.
I bet he would have let her. So you like holding him?
See, look at the TV.
You like holding Carlton?
Yes, I do. Look at the TV.
Okay.
See, we're looking at Mom on March 16th, which that is when she had the baby.
Yes.
And this is us watching the video.
March 16th.
March the 16th in 1995. It's only 10:30 a.m. on the video.
Whoops. Who's that?
Yeah, it's Grandma Rose.
Grandma Rose. Oh, my. Hi, Grandma Rose.
Hi.
Over here.
What's Grandma Rose doing?
Knitting cloth and king cloth and sweat.
Oh, that looks nice.
You're on the sleeve.
Wow.
Dave and Kathy. Hello. Grandma.
Hello, Mr. Flames.
Hey, Miss Connie.
Congratulations.
Thank you. There's Sean. Yeah. So who's next here?
The cutie pie. Around this picture.
Hello, Tom and Barbara.
Oh, yes, video time.
That's right.
The visitor video, are you on that already?
Yeah. In fact, we're probably going to watch the video. Nina.
I wonder.
Well, y'all will be great parents, that's for sure.
Well, some jazz musician like Duke Wellington. In his house, you were happy that you were loved and happy.
Cold. It's Friday morning. Actually, it's Friday afternoon. And let's see Mr. Carlton here. Carlton! Mr. Carlton! Hey, buddy. Hey. Hey. Hey, Carlton. Hey. He just finished eating. He's a happy little boy. Looking around.
Daddy,
How's Mr. Carlton doing?
how are you doing
I'm fine.
with the new baby?
How's Mr. Carlton?
Oh, he is a wonderful.
Is he doing better?
Oh, he's a big, good-looking baby.
Yeah.
Yep.
Are you ready to go home?
Indeed I am. I have to go back home.
Have to go back home. Are you gonna miss Mr. Carlton? How's Mama doing? Mama Nina?
Great.
Yeah?
Great, Mama.
Is she?
She's from... I'm gonna tell him. She's mixed from a good clay.
Oh, mixed from good clay, huh?
Yeah.
Excellent.
Bet.
What are you making?
I'm making Carlton a sweater.
Is it almost finished?
It's almost finished.
Can you show me?
Sure. Here we go.
It's handmade, huh?
It is.
By Grandma Rose.
It's pretty, huh? So we're almost done. That's the sleeve.
And how old is he going to be when he wears this?
A year old.
Oh, okay.
Huh? It's pretty.
Very pretty. Hello, Grandma Rose. Where are you going?
Back home.
Back home to New York, huh?
Yep. Back home. And you take care of that baby and your wife.
Yes, ma'am.
Yep.
Thanks for coming to help take care of Mr. Carlton and Miss Nina. And me too.
That's nothing.
You leave that alone. I'll take care of that. Anything you want to, last word you want to say to Mr. Carlton?
I'll see him soon.
You'll see him soon.
Yeah.
Okay, smile for the camera. Bye-bye. Afternoon. Have some blue bows on the mailbox. One from Barbara and one from the hospital. Have some visitors here. Let's go see who they are. Oh, Gail. You have a baby, Gail?
I'm not talking, Jay. I hate talking on those things.
Gayla Bell, I'm surprised that you ever hating talking.
So do I. You should see. You took so many.
I don't like my accent on those things.
What
This
accent?
is base, the future base burning French.
Oh.
He is now breathing heavy. Could it be that he will be a snorer like Keith Robinson?
Oh, no.
Oh, buddy, are you waking up?
Well, now Mr. William Duke and Mr. Carlton French need a buddy now. So y'all get working. And Mom and Carlton are in the family room. Let's go see what they're doing. Carlton's now 9 days old. They're both sleeping. He's talking to Sidney.
سميناها Carlton. Carlton. يا حبيت الاسم؟ Carlton. اسمه Carlton. Carlton. Yeah. منيحة. الله يسلمك. صبي ايوه قاعد نايم هلا. اسم سيدو سميناه. يا اسمه جون. اسمه جون كارلتون. بتشوفيني في عرس جاك. لما جاك بيتجوز في عرسه. جايين على عرسه. 4 أشهر. يا كمان 4 أشهر. 4 أشهر بتجوز. Yeah, so أنا وجاي.
Doctor's office to get Mr. Carlton's weight checked. See how many pounds he's gained. Or more like it, how many ounces. Mom dressed him up in his cute little hat here. And he's just laying here Waiting, being real good. No one's in the office. It's the best time to come, late in the day.
Let's see what we got. Oh, I think you have gained some weight.
Allison was first 2 or 4? 2 or 3?
3.
3.
8 pounds and 10 ounces.
Oh my gosh.
Wow. He had some cool, just laying here so quiet. Yes, you are. 98.1. All right.
2 months
Minimum.
minimum, because that's when babies can get most of the benefit in terms of immunity and nutrition. After 6 months, their own immune system is kicking in, so they don't need to breast milk as much, although I found more times than others that moms who breastfeed successfully for 2 months, they want to continue breastfeeding.
Okay.
So if mom is going to stay at home and she's done great with it, tell her she can breastfeed until she feels comfortable. Usually if they get to be a year of age and they're still breastfeeding, I approach the moms and tell them, have you thought about stopping breastfeeding? Although I have some moms who have breastfed until 2 years, 2.5 years. I don't discourage them as long as they feel comfortable doing it. So, okay? Right. Okay, let's see that belly. Where is that belly? I don't like you doing that.
Is it good to give them massages?
Like where? In his
I mean,
belly?
just a little bit, kind of.
That's not going to harm him. As long as you don't overstretch him or
Right,
do it,
right.
abruptly, it'll be fine. Now, his belly button, I expect that it will probably fall off within the next week to 10 days.
Okay.
You need to get a Q-tip with a lot of alcohol and then do it around the base of it, okay? This part is dead, so you don't need to put the alcohol up here.
Hi. Hi.
Because it get big eyes, don't it?
So I learned about that wood last time.
I know, and it didn't taste good last time either. It did not
Need
taste
some
good.
strawberry wood sticks or something like
We
that.
have some antibiotic flavored ones. Yes. Say, no, that didn't taste like any. Oh, you didn't like that. Say, your hands are cold, huh? Your hands are cold. That circumcision looks great. You see those hips? Hold on. See those hips? Hi. Let's see, Munchkin. Good job. There we go. That was me. He's hairy.
Very hairy. Well, both his parents are, so
I got lots of hair.
he's got hair on the back of his ears and everywhere. I don't know if that's normal.
See, I'm just hairy. See, I'm not gonna be a bald baby at all. He looks great. And he's growing very well.
Yeah.
So what I'll do is I'll see you back in about 2 more weeks.
2 weeks. What about shots? Will he
2 months.
2 months? And he gets a lot of them or just one?
He gets 3 vaccines. One of them is a drop, it's by mouth.
Mm-hmm.
And the other 2 are shots.
Did I hear they have chicken pox shots now?
Yeah, we have them. It's been approved by the FDA. Now, the American Academy of Pediatrics has not made universal recommendations. So we're not vaccinating kids as a requirement against chickenpox. As soon as they come with the requirements, I'm sure we'll start doing that. But right now, we just are offering it to parents who want their kids vaccinated. We don't have it here yet. We've ordered it, but it's going to take about 6 to 8 weeks to get it because the manufacturer, you can imagine, it's just too busy trying to keep up with the demand. Okay, Munchkin. Okay.
Miss Tina. Hello, Tina.
Hi. Am I supposed to say something?
No.
Okay,
If you want to. Tina just brought us some food over. Carlton's sleeping. He's now 14 and a half days old. We can... Give him a little massage here. See how big these hands are. Pretty small hands. Here's his big foot. He is not wanting to wake up. His little face. Sometimes this will get him to open his mouth, but not now. Definitely tight-lipped. The arms here. See all the hair on his arms? Sleeping in Daddy's lap. Up a little bit here. Carlton.
Well, there are terrific events going on throughout the state this weekend. So in addition to the zoo, we want to remind you about the Roost Bazaar, storytelling barbecue and summer celebration.
Saturday, starting at 8 in the morning in Moreland, Georgia, and in addition to an old-fashioned barbecue and storytelling festival in the afternoon.
Now laying down in his basket here. Uh-oh. Uh-oh. Hey, Carlton. Hey. Hey. He's just waking up. Uh-oh. Carlton. See, even Carlton, the good little baby, cries a little bit. He's hungry now. And Mom's in the shower, so he'll eat in a minute. What you doing?
I'm gonna give him a little. I'm gonna wash him.
Oh,
Clean.